Hello everyone, welcome to OncoCipher. Today we'll discuss Coombs test, which is an extremely important concept for all your competitive exams. So what is Coombs test? It determines if hemolysis has an immunological basis, that is, if antibodies are present or not. They could either be present in plasma or RBCs. So now Coombs test is of two types. It can either be direct or indirect. Let's begin with direct Coombs test, which is also known as direct antiglobulin test. So what does it detect? Listen carefully. It detects the presence of antibodies on the RBC surface in vivo. So basically, it is detecting the binding of antibodies to the surface antigens on RBCs in vivo in the patient. So, how do we do this? Now, let's say, for example, these are red cells of a patient which have IgG antibody. To this, we add Coombs antisera, which is nothing but anti-IgG antibody. That is, this is an antibody against the antibody which is present on the red cell of the patient. So, obviously, what will be the inference? There will be a glutination of the sample. Understood? So, what is it used in? It is used for the detection of immune mediated hemolytic anemia, for the detection of hemolytic disease of newborn. This could either be RHD or ABO hemolytic disease of the newborn, and most importantly, for the detection of mismatch transfusion reaction. This is very important. Now let's come to indirect Coombs test, which is known as indirect antiglobulin test. Now over here, the patient's serum is mixed with a normal or donor's RBCs, and antiglobulin reagent is added to this in vitro. That means we are detecting whether antibodies are present in the patient's serum. So, what are we doing? The patient's serum is mixed with normal RBCs and an antiglobulin reagent is added to this. All right, so let's see how this is done. So, let's say this is the patient's serum in which there is presence of antibodies IgG. Now, to this, we are adding absolutely normal group O red cells. They do not have any antibodies. Okay. Now, obviously, when you add red cells, which are absolutely normal, to a serum which has antibodies to it, these red cells will get coated by those IgG antibodies, right? So, this is what we get here. We get red cells which have now been coated with IgG antibodies. And to this, we add Coombs antiserum, which is again, like I said, anti IgG antibody. What will be the inference? Again, there will be agglutination. So, in indirect, we have proved that there are antibodies present in the serum of the patient, and in direct, we proved that there are antibodies present on the RBC surface of the patient. Got it? So, what is indirect Coombs test used for? It is used for compatibility testing before blood transfusion. It detects antibodies in the patient's serum prior to any blood transfusion. And very importantly, in antenatal care, it helps to screen pregnant women for antibodies in her serum that may cause hemolytic disease of the newborn. All right, this concept is extremely important. Please keep revising this and keep studying this. Okay, thank you.